The results that are shown at this ASCO meeting on Erbitux plus chemo in the first-line treatment of patients with metastatic colorectal cancer show the importance of the KRAS status of the tumor of patients with metastatic colorectal cancer, and demonstrate that in patients with a KRAS wild type, that the combination of Erbitux plus FOLFIRI in the CRYSTAL study or Erbitux plus FOLFOX in the OPUS study is a very active treatment. And it shows that in patients with KRAS wild type tumors, there is a huge difference and a huge benefit for patients treated with Erbitux. Indeed, in the CRYSTAL study, we see that there is a 32% lower chance of being progressive when treated with Erbitux FOLFIRI compared to FOLFIRI alone. In other words, the hazard ratio for the treatment for FOLFIRI Erbitux compared to FOLFIRI alone was 0.68 in the wild-type KRAS patients. And that's a very important finding. These data presented at this ASCO meeting are an important step forward, because it's for the first time that we can show in the first-line treatment of patients with metastatic colorectal cancer that we can enrich the population and that we can show really for which patients the new biologicals such as Erbitux are of benefit for patients with metastatic colorectal cancer. The Erbitux data will impact on the clinical practice because we can now select patients who will have benefit, and we can select out also patients who will not have any benefit of treatment. But by demonstrating and enriching the population and showing really a much bigger difference for the combination of chemo plus Erbitux, we can really administer the drugs to the patients who will really have a major benefit of it. In colorectal cancer, we have seen over the last few years several other targeted agents also. And the data with Erbitux plus chemotherapy are for the first time data in the first-line setting of patients with metastatic colorectal cancer that show us that we can demonstrate, based on the molecular profile of the tumor, that we can select out the patients that benefit. And that is a major advance. These results demonstrate that Erbitux is really a targeted therapy and that we can select patients based on their molecular profile. It's for the first time that we can use and select the KRAS or any other molecular marker in colorectal cancer in the first-line treatment, and that's a very important advance. These results mean for patients that we can really help as a physician and as an oncologist treating patients, that we can more accurately predict for the patient whether he will have benefit of the treatment or whether he will have no benefit. And also we can predict and tell to the patient also and propose him a treatment that will have a more important impact for the patient. And also potentially we can then also, this may lead to cure in some patients, because if we can give a treatment, FOLFIRI or FOLFOX, in combination with Erbitux in patients with initially non-resectable metastasis, if we can downsize these metastases so that they become resectable, this may lead to cure in some patients.